believe it or not.
It is approximately 7 o'clock. I would call to order the Tilton Budget Committee, January 7th, 2015. With the permission of the Budget Committee, I would like to skip meeting minutes at this point in time and go directly to our guests who have come to provide us information. First on that is Mr. Dones from the Recreation Center. Yes, sir. Good evening. Good. So we have questions for Mr. Jones. Would you like to come up and join us, or stay over there, sir? Yeah, why don't you come on up? I'm going to have limited voice, which is okay. That means we'll get out early. Okay, there were some questions from committee members. You are ready to field them, sir?
I will do my best.
Thank you, I appreciate that, sir. Would you like a cookie?
I'm good with that.
Okay, so am I. All right. Questions?
Did you get my email?
Yes, we did get your email.
Okay.
Thank you.
That's important.
It was good. And I hope you got mine. I'm a very simplistic man. I try to keep things as simple as possible, sir. And as my age gets older, it becomes more simple. Yes, ma'am.
I believe someone on the board had asked for a copy of the,
Detailed transaction report?
Yes. The detailed transaction report.
we did that?
No? You did not get one, ma'am? We'll make sure that you get one.
I think we also got a breakdown of the recreational programs.
Might be a quick evening for you.
Yeah.
Might be very quick. I did promise you I'd let you know
Yes.
what the year-end numbers are, and they didn't change from the email, so there's no update there.
So there was a minimum profit.
Minimum.
Minimum. It was going to be absorbed with the normal operating costs?
It already has.
Okay.
It revolves, so.
Already spent.
Oh, yeah.
Okay. And Catherine, any questions?
Do you have, my understanding was mainly the increase was because of wages. There have been wages given for a number of years, and you're trying to bring them up to today's standards, if you will. Do you have I don't know, it's like we have a 10-year plan for roads and sidewalks. Do you have a plan for the Pines that shows how staff may increase or how programs may increase, but do you look to the future?
Yes,
Do you
we do.
have anything down
Yeah.
that shows?
Well, I can tell you
I'm wondering why, this wasn't more planned for, because it's kind of a jump all of a sudden.
I'll give you the personnel piece real quick. It's done by position, and it's also done by merit and will. So the plan is in place. We actually put the plan on hold for, in some positions, 3 to 4 years, in other positions, not so long a period of time. So the plan is, yes, in place. How far out it goes, I would say probably it goes out maybe 4 or 5 years.
Because if you had such a plan in place that showed these types of increases, like maybe in 3 years, you're going to have some increased staff, because you're going to have increased programming, the towns could budget for it more easily. Because they know, okay, in the year 2017, we're going to have extra staff, extra programming, it's going to cost us X amount of money more.
Which we have in place, in-house, which is something, because it's personnel, is something that I'm not just going to put out there. You've already got it in the previous email where the increases are. Actually, which members of the staff and which members of the new staff, if it goes through, are going to get. So you've actually seen that piece of the puzzle, but the rest of it is the personnel
Except that you
thing.
would put it on hold, which now is more of an increase than would have been anticipated.
So it's more of a burden on us.
It's actually not more of an increase because the people that, or the personnel, I should say, that are getting the increases are not the type of, well, not the personnel that have been put on hold for 3 or 4 years.
Oh, interesting.
Yes. So I guess, make this really clear. Let me use myself for an example. I don't want to talk about other personnel. I've been put on hold since I was hired, okay? In fact, I gave back my raise for my first year. So there are people that, and I'm not included in 2015 either, but there are people that have been put on hold for a certain amount of time. The positions that you've seen, one is a new position, and the other two would be the regular step increase. So there's no added burden, I guess is how I'm trying to say this. It's hard to explain without seeing the big picture, but unfortunately, I can't put that out.
That makes a lot more sense what you just said. Thank you.
Yeah.
And I appreciate the breakdown that you gave us and just an idea of that. And we shouldn't have to get into the details of things like that. But if you, I have 2 questions. If you
Sure.
got the increased amount, do you think that would cover things to go back to the original amount next year? Or do you think it would be the new standard for next year?
Would be the new standard for next year.
And the second question,
I'm sorry, just to finish that
Yeah,
thought, because the
please.
building's not getting any newer.
yeah. And what would the ramifications be if you didn't get that increase, if it was the same amount as last year? How would that hurt
Long
you?
evening. Obviously, the board would have to meet right away and figure out, where the priorities are and how we could absorb that type of a situation. And I can't give you
No, I know,
a
but...
short answer there.
And I wouldn't want detail stuff. What I'm asking for is, would it be catastrophic?
In my opinion, the Pines Community Center, and this is a hard thing to say, is walking a very fine line right now. So any kind of problem, building or otherwise, that is large, let's say, we can't recover from it. So I guess to answer your question,
Yeah,
yes,
and
it would be.
And that's why I ask, because, just to gauge how harsh it would be if it happened to you, because I believe for myself and most, if not everybody here, we all support the Pines Community Center, so it gives us a better understanding of what happened.
In fact, today, we were at the Union Sanborn School.
Yes, we were.
And got very good reviews from the work that you've done with their students. In fact, we were talking about, down the road, looking at an after-school program that could be possibly a cooperative program between Pine Center and Union Sanborn School to take a look at filling some time in that children's day. Towards the end of it, we were talking about the school being responsible for providing like tutors and maybe some recreational activities coming from the Pines. They're providing a late bus. So a good interplay between the two. This is some really exciting things that are going on over there. And again, I'm not looking for specifics. How many staff do you have online total?
Are you looking at full and part-time?
Okay.
In a year's period of time, I'm going to say 17.
Okay. Of those, how many have been put on hold for raises more than 1 year, more than 3 years?
About 75%.
Okay.
How many of those would be in a position to help with an after-school program in conjunction with Union Sanborn?
3.
Okay.
Okay, good.
The other thing we all have to start looking at, and this just happens to come up now, but even, throughout the town, throughout everything else, is unemployment is quite low. In New Hampshire, it's very low, almost to the point where it's going to start getting detrimental to the
Yeah.
economy, and inflation's going to go up. So, I don't know if this is the right time to mention it, but you and others have to look at the possibility of keeping good people on might end up costing us more. So maybe, get that into a plan and bring that into our thought process of maybe it's, not so...
And I agree with that point. We're Union Sanborn, and we have a school counselor that has a master's degree in counseling that's taking a BA's position. While we were there was also a person who called, that's fully certified in English, that was applying for a paraprofessional job, because there was nothing else at that point in time. So again, we're going into that phase. Good. Eric, any questions?
The only thing I just saw is on your revenue here, and it's just more of a nitpicking thing maybe, but,
Can you speak up?
yeah, on the...
Thanks.
You're welcome. On the, your excursions and trips program, you have revenue of $75, and then, but down here, you have expenses of almost $1,900. So I guess it was more of a curiosity. Is that just a miscoding, something that maybe not getting coded right? Or
It is.
Okay.
The expenses, actually, where your revenue is, just to let you know where it is for that program, global pay revenue.
Okay.
So it's not showing up in a lot of these accounts, and the reason that it doesn't is because this is our online registration. So if you look at that, there's, I don't know, $10,000 that would normally go into those other accounts
Under global pay.
under global pay. So it is a little confusing, but that's the way that our accountant does this report. I can actually break it out from there
No,
by going to global pay, but I don't bother. It's just too much work for...
Further discussion, Eric?
no, I figured there was an explanation.
Jules.
to that, So,
Yep. Thanks.
I've had my say, so that's a good, I can save my voice. Jane?
Any word from Northville yet of whether or not they've made a decision?
There have been no decisions made. I go before their board on the 23rd of January.
They're very late. Jane?
Nothing, no.
John?
No, said.
Finally, Mike, the friend that brought cookies, which you'll be happy with. Go for it, sir.
No.
John.
The only question I had is, this is just what I wanted to see, the breakdown of everything, and hasn't generated any questions for me to ask.
Questions of us, sir?
I do not have any.
You can actually go home. You actually have a life. Oh, I'm sorry. Pat?
Well, I still have the question of the revenues, the income coming in. You have it listed as $282,000 as revenue coming in, and then you have your expenses as 200, last year was 265,000. I really, if you just look at the 2015 budget is 282,000, and then look at the 2014 budget, which was 265,500. I don't understand why you're asking for such an increase in the difference in like $7,000 in increase. Can you make that up in a fundraiser? Can you make that up in a grant and just level fund that request? To me, $265,000 in expenses versus $282,000 in income, there's a little bit of room there.
I'm not quite sure if I follow you where there would be room. And the reason that I say that, if you're going to have $282,000, give or take, of expenses, you've got to have $282,000 of income. Where is that gap?
Or you could look at it, if you have $282,000 of income, I have $282,000 to spend. And sometimes if people say, I have $282,000 of income, but I only have $265,000 that I can spend, sometimes we look at the budget a little bit differently. And we say, okay, where can I make this up? And that's where I have a problem with it, because I think that as much good as you do over there, I still am adamant about, well, could you make up the $7,000 extra that you're asking us to chip in a grant, or a grant elsewhere other than local grants that you ask for? Because consistently, the last 5 or 6 years that have come in, the 6 years that I've been on the board, it's always been just local grants that we see coming in. But I know for myself, I probably said this before, that going for senior grants, 1 out of every 10 or 11 grants that Jane and I look for seniors has to be about kids. And I'm just,
We've even been told, if it's not programs for children, don't call us.
so I'm thinking that, a fundraiser, that difference in $7,000 means a lot, because all of our outside agencies that have come into us have level funded or gone under. Our tax rate went up $1.84, $1.73 of that was the school, and a good portion of the remainder was fire. And although we indirectly have control over that, we really don't have control over it. But we do have control over this, and I don't want to keep saying that we appear like I'm coming down on the pines. I think that there's an outlet for you to look at that could help us out, and we wouldn't have any problem saying, okay, that you've done your due diligence, and let's go forward and we'll support you. You have my support. I just wish that you would it's just a few $1,000s that I think we could go elsewhere and get, rather than coming to the town that's already giving you $57,000 for level funding, and you're asking for $7,000 on top of that. That's a big jump. Personally, that's the way I feel.
Any response, Jim, or?
I don't know.
Okay.
That would be a response from the
Can
council.
I ask a question? In these grants that you've seen that involve children, have you referred any of them to Jim?
In the past, I have.
Yes, we have.
Okay.
I mean, we have,
No, go ahead.
we have, one of the line items here is a $2,700 under what was budgeted for income for grants and donations.
How much?
One of the line items, $2696, so $2,700 less came in than was expected.
For grants.
For grants and donations, line 480.
Which, can I jump in real quick, because there's a little asterisk that you don't get to see. There's a $5,000 grant on the way that's going to go into that account for 2014, but I cannot put it down on this sheet till it
Yeah.
comes into my office.
Okay.
I fully expect it this week. So you can take that
And what grant is that?
$2,700 hold.
Which grant is that, Jim?
Is that
Which one of the grants?
WLNH?
Pardon?
WLNH.
Further questions from the Budget Committee?
Unofficially on the record.
Unofficially on the record.
Love you, WLNH.
Any further questions from the Board of Selectmen? Jim, thank you for your patience.
Thanks for having me back.
Not a problem,
Appreciate
sir. We're always here.
Enjoy the balmy weather.
Thank you for the good work.
Absolutely, good work.
Thanks, Ken.
Enjoy that trip to Florida tomorrow.
I wish.
Me too.
Thanks again.
All right, we have second group of invitees tonight. Genesis, would you like to
The
come up
Pines,
and join us,
those
please?
can make some money this week.
Do we need another chair?
I can grab hand on the way up.
Okay, great, thank you. Coming to join us? Okay, that is fine. We will not ignore you.
It may be warmer up here, there's so many others.
Welcome.
Good evening.
My apologies for the delays, but we have been bouncing through the cycle, and I'm glad to come in. If you'd introduce yourself, and I'll have the board introduce themselves.
I'm Kristen Welch. I'm the Director of Development and Communications at Genesis, and I recognize some of your faces from last year and the year before. Thanks for having us.
I'm Susan Stearns. I'm the President of the Board of Directors.
Welcome.
Jim Hundreiser, I'm the treasurer of the board.
I'm Kim Sperry. I'm a member of the board just for 1 year, so I'm really here to kind of...
Wonderful. Behind you is, this is Catherine Dawson who's talking, so we'll ignore her. John.
John Bossy.
And I'm John Scanlon, I'm a selectman in this one.
John gets double duty as both a ex-officio member of the Budget Committee and a member of the Select Board.
I'm Jane Alden.
Wayne Brock.
Juliet Harvey.
Stanley Brown.
Eric Pyra?
The floor is yours.
Thank you very
You're
much
welcome.
for having us in this evening. Of course, it's quite a brisk evening coming in the door. But
Keeps the mosquitoes away.
as I said, I'm the president of the board at Genesis, and in the interest of full disclosure, I'm also the director of philanthropy for NAMI New Hampshire. And by the way, Mr. Scanlon, my boss, Ken Norton, sends his best. I just
Yeah.
saw him this evening on my way out, and he said to say hello. I've been on the board at Genesis now for, I believe I'm just begun my 8th year. And quite honestly, I come to this role because this work that I do, I did not choose, it chose me. I have a family member who is a patient at Genesis and has been for about 15 years. I have, prior to coming to work for the NAMI, with the National Alliance on Mental Illness in New Hampshire, I worked for 7 years for the Mental Health Center down in Greater Nashua, so I do have some understanding of the way the mental health system works here in New Hampshire. And as I said, this is more a vocation for me than anything else. We know that 1 in 4 of our family members, our community members, lives with a mental illness. We know that the effects of mental illness has significant impact upon not just the individuals, but families, communities, and the overall health, as well as the costs for communities. Genesis is the designated community mental health center for 24 towns in Belknap and Southern Grafton County, of which Tilton is one of them. We are required, not only are we required by state regulation to provide 24-hour, 7 days a week, 2,365 days a year emergency services, but we also are clinically required to provide that sort of access, because the reality is, as we know, health crises don't occur between 9 and 5 on weekdays necessarily. Although we are required by the state, we receive very little support for those emergency services, and we do ask every town that we serve to support us. We currently receive funding from 19 of the 24 towns that we serve. We are the only emergency psychiatric services that are available to those 24 towns that we serve. And I know that we've had a relationship, and I know Kristen can speak more to that, with your emergency responders here in Tilton. We've had a relationship with the local school and other healthcare practices. So we recognize the...
You need a microphone. Whatever learning is under my elderly age, hearing starts to go.
So we recognize, obviously, the constraints that you face every year in trying to balance your budget, and hope that you will consider, though, the long-term impacts and costs and how important the community's mental health is to a healthy community.
Excellent. Would you like to add anything?
Sure. As far as services to the town of Tilton itself, so we served 135 residents in your town last year, and we provided about $20,411 in charity care. So that's care that we provided for free. We won't get that back. It was residents who may not have had insurance, they might not have had financial resources, but they were in need of mental health care, and so as Susan said, we treat them. We're required to do that. Let's see, for emergency services, 33 of your residents utilized that program. That was a pretty big increase over the previous year. The year before, it was smaller, so it was about a 27% increase over the past year in residents from Tilton who needed emergency services. Charity care to the town has increased by about 148% over the past 2 years. It's really been going up. So we do provide quite a bit of services to your town. As Susan said, we're in the schools. We did have a clinician in the school itself. That person is not there now, but we are working on getting her back in, or getting somebody back in. But in the meantime, one of our children and family coordinators meets monthly with school guidance staff to, troubleshoot, brainstorm, ensure that there are no issues and that the children are getting care. We try to have a clinician in as many school districts as possible so that families have better access to care. It's really challenging to have to leave work for appointments and stuff, so if they can see a clinician right at the school, we do that. We have worked with your police department to provide trainings and offer trainings. We do that as a community benefit. We do not charge for that service. We just provide it. Our emergency services team will go out and do that. We have worked with the senior center In the past, we have a program that's called REAP, which is a program specific to older adults, and so we have had, our REAP educator has been to the senior center and done programming there. I believe there was some turnover, so I'm not sure where that's at the moment, but it's happened in the past for sure. So, really just wanted to answer any questions that you might have about our services and clarify anything that maybe there's misconceptions about or...
Super.
First, we really appreciate you taking some time to speak with us, and thanks for doing that. From the financial side, we're in a similar challenge to where you all are in terms of dollars, resources. We have our most updated numbers, and we continue to run just very close to or in a deficit at many of the months throughout the year because of the mandated services. Some of these unfunded mandates coming to us at really challenging times. Our staff, too, has not had raises in 5 years, and we, too, are beginning to worry about some of those things that you mentioned as well about retention, keeping the quality of services high, strong, ongoing. The demands of on-call have continued to challenge our staff, and we've had to have more staffing on weekends throughout the year and other times that, as Susan said, it's not a 9-to-5 business at all anymore, and the increase we're seeing in Tilton and across our whole catchment area continues to grow and to meet that demand. And I would say the other place where we're starting to see much more growth is in children, and so the time, the necessary needs that we have to provide those support services continues to be a secondary challenge on top of our financial situation already. So we do the best we can to balance our books as best we can. Currently this year we've already tried to make about $170,000 in cuts to remain in balance because we haven't had the revenues to support that. So we're constantly at this tension of balancing services with revenues and trying to maximize those services as we serve the community and comply with all state mandates.
Super. Ma'am, would you like to add anything?
No.
Okay, good. Told you I wouldn't ignore you. And Catherine, you moved. You get to be first.
Oh, I couldn't hear. Out of the numbers you've served from Tilton, do you know how many of those were from a transient population?
I do not, no. I could try to find that out for you. If they're from a transient population, we may not have an address for them, so...
Yeah, I was going to ask, by transit, do you mean actually homeless without an address, or are you thinking there's people who are here and moved on?
Well, I know that a number of people have come in to seek assistance from the town who came from Genesis, but for whatever reason, the town, they did not qualify for assistance from the town. But there's been a number of those, but yet they were receiving services from Genesis. So I was just curious how many of those are part of your figure.
If they were receiving services...
We do have a huge transient population within our apartment dwellers who would be considered not homeless.
Right.
But still, it's very transient.
Right.
Because I also serve the health.
Well, and that is much the case with many people with severe mental illness. The reality is that often their address does change frequently. So similar to what you're talking about, your apartment dwellers, that would be, and that we see that across the catchment area. That folks with severe mental illness have difficulty maintaining that stability. We do strive with our services. For example, my family member has been the benefit of assertive community treatment services through Genesis for the last year. We only just a year ago received funding from the state for that particular practice. And it literally meant the difference between his having to move into probably congregate housing or some sort of group home facility because he was not doing well, to the point, a year later, he's actually working part-time for the first time in probably 25 years. He's, never going to be well, as, we might like to think, but it has completely altered his life. So there are programs and still there are evidence-based practices like ACT that, as we move forward in implementing them, that we hope that we can, impact others' lives. And I think that the population that you're talking about are folks who probably need some more intensive services.
And I have one other question. How many, excuse me, what services are available to those who do not have the ability to pay, do not have insurance?
The emergency services are available to everyone, period. I don't know if you want to expand on that.
We are required to provide emergency services and an intake to anyone, regardless of their ability to pay. So as far as continuing services, We do get a grant from the county, from Belknap County, and we get one from Stockton County, so it allows us to provide short-term therapy to people without insurance. That would not be people. If somebody had a severe mental illness, they would likely qualify for Medicaid, and we have benefit specialists who would work with them to get them.
Well, I have
on
to
that.
disagree, because I have a couple family members who don't qualify for Medicaid, but yeah.
So if they don't qualify for Medicaid and they're able to access our short-term therapy services, we're able to use the grants from the county to help subsidize the cost of that. It's
So those emergency services are available?
emergency services are available as many
Sometimes
times
that's
as they
very
need
important.
them, whenever they need them, like Susan said, around the clock.
All right,
So,
thank you.
sure. And actually, for emergency services, that includes an emergency services visit and then up to 6 crisis stabilization appointments. So they're able to come in 6 more times if they need to, and that's when we try to also work with them to get them on benefits if they're able. That as well.
I had a couple questions. So you are able to bill insurance and Medicaid for services. When you're providing services, are they at facilities, or are they some in-home, or?
Emergency services are usually provided at the hospital.
Yeah, through
emergency room.
LRGH or whatever.
In Franklin as well.
Franklin.
Depending on the service, I mentioned the Assertive Community Treatment Act, those services are provided in the community, so it depends on what the treatment modality is. The bulk of the services of the agency are provided at, certainly for adults, and not older adults, but the, adults, not children, not older adults, are provided at our clinical offices.
So would you have any in-home follow-up with people at all?
It would
After the
depend
fact?
on their treatment plan. Everyone has an individual treatment plan. And if they required that level, as I mentioned, my family member, it's been a lifesaver in many ways for him to have that level. And there actually is still, we do have capacity with the ACT team to be able to add additional people. It's such an intensive service that you can't give it to everyone.
Yeah.
And it is for people who are very severely ill.
You have the ability to step in and care plan for people and move them to another level of...
That's always the goal, that you progress, that someone will be able to move on and not require that level of service. It's interesting. As I said, my family members received the service for a year now, and we just had a meeting with staff person at Genesis, the program coordinator, because, as I said, he's working part-time, he's doing so much better, and they're talking, well, is it time maybe to pull back on some of those services? And so here I sit as board member with looking those fiscal responsibilities, and then as family member, I'm like, oh, no, don't change anything. It's all going well. So there is always that tension of and I can, literally 2 days ago, was going through this concern myself of, I understand he's doing better, but can we just not move anything?
So I guess my question in broader sense is, so like when you see somebody and you're providing services, you're able to care plan for me and follow them through, not just treat them and not see them again.
We have several
Okay.
patients that are multi-year patients that have been with us, and we have, over the course of the last 2 years, been revising some of our counselors' time to be reaching out to people who have been no-shows. So you haven't shown up, and we're contacting them back to say, where are you? You need to come in. It's time for a follow-up visit. So the whole industry's sort of been shifting that practice. It used to be years ago, if you didn't show up, we wished you well. We're learning through better practices that is often a sign of need for more help, more services, more attention, and so again, trying to alleviate that as we can.
So out of like the 133 residents of Tilton, do you have any that are multi-year or people that you've been following for a period of time, or?
I am sure,
Yeah.
just from my experience in the field, just that number, I would be pretty shocked if there weren't some.
And from that
Catherine,
number,
it
that's...
looked like you had a follow-up.
Just a clarification, you said that you provide services to Franklin Hospital, but that's Merrimack County. My understanding, there's another agency that's designated to...
We don't serve residents of Franklin, although we provide all the emergency services through an agreement with LRG Healthcare at Franklin. So we do provide we do cover the emergency services for anyone coming through Franklin, although we would then refer someone, if they lived outside of our catchment area, to Riverbend Community Mental Health, which covers Merrimack County.
So if they were not a Belknap County resident, hand them over to?
Right, right.
Okay, that's what I thought.
The reason we cover Franklin is because of the LRG healthcare connection.
That's what I thought.
Because, yeah.
Thank you.
Well, and obviously, we're so
And
close here,
close.
you know. It's-
We also provide the medical staff and the training for the designated receiving facility at Franklin. So we just get them on that capacity as well. And just a quick point about the coverage at the hospitals. So one way that we try to save money for emergency services is so we cover 3 hospitals, and you can imagine sometimes there are emergencies at 3 hospitals. So, but we still only have 1 staff person and 1 psychiatrist on call, and the way we can do that is we're able to use televideo so that that person can, you know, if they needed to, treat multiple patients at multiple locations, and we wouldn't have to pay for an extra person to be on call. So we're able to do that. Insurance allows us to bill for that. So that's one way that we are able to serve all 3 hospitals.
Excellent. John, I'll be right with you. Pat, I saw a hand sliding up. Do you have a question?
Out of the multi-year clients that you have, how many of them see the same psychiatrist or psychologist consistently?
Well, actually, it's interesting because we have had a significant, there's a difference between a no, actually, I was going to say, we've had a significant shortage of psychiatrists for a number of years, so that you were seeing the same psychiatrists for a long time, because we had a really hard time recruiting them, as do people, other practices across the state. In terms of psychologists, if you're talking about a therapist, you would see more turnover there. That's usually a master's prepared clinician. In terms of psychiatry, there was very little. We've recently had great luck to bring in 3 new practitioners in August, which cost us a small fortune in recruiting fees. But, so you may, if you know some folks, they may have recently shifted in terms of their psychiatrist with Genesis, because we are so grateful to finally have enough psychiatrists on staff to be able to serve people. So in terms of the master's prepared therapists, you would see definitely more turnover. We try to keep people, obviously, with the same clinician. If someone leaves the agency, we can't obviously.
If it's a multi-year patient.
We try, and we definitely try. Those multi-year folks, they tend actually to have, particularly case managers, which I often think is the most important thing as a family member in your loved one's care plan, is that case manager. And if you think about, someone who makes sure that, all your medical appointments and your therapy appointments are coordinated, along with, your health appointments and all that kind of stuff, and your benefits appointments and those things. I mean, I could use a case manager personally in my own personal life, but the case managers are really key. Obviously, a therapeutic relationship is important, but that case manager for those multi-year patients is really key. And that can be really a real struggle for us sometimes, because they tend to be bachelor's level clinicians, so they also, classic, they go to graduate school, they want to move up, and they do, and we hope we keep them, and frequently we do. But that said, we also have some case managers who have been doing it for a very long time and who have worked with some of those multi-year folks, and we deliberately do that. They form those relationships. We want them to be there. So it's going to vary.
But is it possible in the multi-year clients that the client will see different people during the year and not stick to one person? Is that possible?
It's possible, although it's also more likely they're seeing multiple people providing multiple levels of service for those individuals we're talking about. For example, my loved one sees a psychiatrist. He has usually, because they go through there, he gets services 7 days a week. So usually has 3 different functional support service workers who come in to help him with activities of daily living and quite honestly make sure that he's safe, because he's had some self-harming behaviors that have been really scary in the past. And he also has in the past seen a therapist there for different periods of time. My loved one has a diagnosis of paranoid schizophrenia. He does not believe that he has a mental illness. So he's not crazy about seeing the therapist on a regular basis, and sometimes you see that with some of these folks. And so he has a case manager. I I will say that he's seen the same psychiatrist now for, how long has Dr. Jelnoff been there?
Dr. Jelnoff has been there about 4 years.
So for 4 years, he's seen the same psychiatrist, and he has had the same case manager, I think, for 2 or 3. So we do
But
try.
that's a family member, and you're familiar with that family member. So you would be more apt to follow where that family member goes as well. What about the person off the street that has children and needs help, and, they go in and I need some help, and they get pushed from one caseworker to a psychologist, or they see someone different every time they go?
The reality is that we can see a lot of turnover in the agency. The reality is you can have individuals who come in who actually want to change clinicians. And then the reality is, though, if someone has a severe mental illness, we are going to do everything we can to keep them with the most stable treatment team possible. However, unless they have a guardian, they can choose and say, no, I don't want to be with this provider. They can also say, I don't want to come in. So that's the reality of it. But no, we definitely try to maintain, and that's a clinical measure, that continuity of care. And it's a real challenge for us because of the no raises. So we attract a lot of folks out of school, and they move their way up the ladder, so we see that turnover. But there's definitely, the standard of care would be to maintain as much continuity with their clinical care provider as possible.
John, Jules has a question, then I'll come right back
Go
here.
ahead, yep.
Yeah, go ahead, Jules.
I just had a question for Kristen about the demographics. You stated something about care for Tilton residents went up over 100%, and if you could give me just any indication of the demographic, children mainly, or?
Actually, as far as where the charity care went up, if you give me 1 second, I can tell you.
Okay, I didn't know if you had it up.
I imagine it's probably in the 18 to 59 age range, because that's typically,
I think there was no charity care for children or seniors.
this year there wasn't, so let's see where.
So what, something went up, Tilton residents, you said,
Yeah.
over 100%.
That was for the charity care provided to Tilton residents.
Okay.
So, yeah, it was all in that 18 to 61-year age range. Children are typically fairly well covered. It's sometimes that age range where people
Yeah.
slip through the cracks.
Actually, on one of the notes, it was 39 children, 83, 18 to 61, 13, 62 and higher.
Okay. Thank you. And so that's an increase. Did any particular indication why the increase?
It's really hard to say. I mean, it's such a tricky
I
thing
know.
because it,
Just thought if you happen to
fluctuates
know.
really,
I
year
think
by year.
nationally, we're
I
seeing,
think,
though,
yeah.
or at least statewide, and regionally. I also work at Plymouth State University, so from a institutional perspective, we are continuing to see an increase in the usage and need of services for counseling services that we provide, and it just continues to modify with the trends that we're seeing at the center and through Genesis and the organization, that we're just seeing an increase overall in the number of students who are on medication, the number of adults who are on medication. The need for clinical mental health services continues to just be rising nationally, and we're a part of that national.
Okay, so it's nothing in particular to Tilton.
No. It's all a part of it, but it's then, of course, putting burdens onto our, the needs for us to continue to increase our services or increase the number of staffing to provide the services that we need.
And that's just charity cases. You could have maybe only 2, and
then add
2 more, and
There was an increase in almost every town in the charity care.
Okay.
It wasn't just it was across the board.
Okay, thank you.
Do you do any referrals for veterans to the VA at all?
We do. Some of our staff are on I'm not sure what's the word I'm thinking of, a coalition, the Veterans Task Force to do that. So we refer people, we help facilitate.
Because I know there's a big push in the VA for mental health. Do you do anything with they call it a CBOC, community-based outpatient clinic down here, and then, of course, in Manchester?
We do not.
Because I know they have a mental health services here in in this office here, so.
We are finding some challenges, though, with vets who don't want to be associated with the Veterans Association, and so then they come into our care and responsibility. So as some of the national issues have been highlighted, we have found some of those statewide as well. So there's a balance act of choice, and so we're trying to respect the client's choices.
And not everyone who serves qualifies for VA services either, so we also find that struggle as well.
Jane?
Yeah, I'm just curious, how much do you charge an hour for your services?
It depends. It depends on what the person has.
It's a sliding scale, then?
It's,
It also depends on the
it
service.
depends on the service, and so it depends. I have the rates, I would be glad to provide you with the rates for Medicaid.
Okay,
but I don't have the rates for, we accept hundreds of insurances.
Okay.
And-
So it really depends on the...
It really
the
depends.
And some of it is now negotiated, that
Okay.
Right.
through
All
the
right,
state organization, they...
Your practitioners, how many are social workers and how many are psychologists?
We have,
How many PhDs do you think we have? That's probably the easier
I
question.
don't believe we have any PhDs at the moment. We used to have one. She has left. As far as medical providers, I believe we have 5 medical providers, so MDs or APRNs right now. And
But a case manager would be a social worker or a psychologist,
a case
possibly.
manager would be a bachelor's level.
Okay. Oh, okay.
person.
Yeah.
So, yeah.
Often
Not
it's
an
someone...
MSW.
Correct.
No, usually that's a
Okay.
That
therapist.
would be a
All right.
therapist.
Occasionally, you'll find a case manager as an MSW, but usually, by the time they get their MSW, they're looking towards licensing and...
When you talked about 33 utilized emergency services, what constitutes an emergency service?
So an emergency services is if somebody is not feeling safe, if somebody in their home is not feeling safe because of someone's actions or symptoms, maybe they feel like they want to hurt themselves, maybe they feel like they want to hurt somebody else. Anything can really trigger a crisis like that.
Like Black Friday shopping or something.
Black Friday shopping.
But the ones that we have documented are those who have sought out and we have provided services to.
Right.
And most of those you say are done through Franklin Hospital, so that's where you would...
Either Franklin Hospital or LRGH.
Okay.
Or Spear.
Or Spear. It could be any of those 3
Okay.
hospitals.
All right.
And anybody can be referred, you can call yourself and refer yourself to emergency services. You can walk into the hospital emergency room and we'll come see you at the hospital. It can happen a number of ways. The police can call us and we'll see you that way.
Often it is a family member or someone in the community who makes that call. It's less often to be the individual that at least prompts the emergency services.
Do you have any idea of the 135 residents you've served, how many contacts you've had? Has it been a one-time deal? Has it been...
Tell you, I don't know specifically for each person, but out of the 135 people we served, that made up 2,135 what we call events. An event could be coming in for therapy, it could be emergency services, it could be functional
Follow-up
support
appointment.
services, it could be ACT team, so it could be
Could be
any
a
of those
phone
things.
call.
It could be a phone call. I don't have the detailed what they were, but we provided 2,135 events to the 135 people.
So if somebody calls Genesis from the Tilton area and says, I would like to make an appointment to see somebody, that's considered an event?
No, that is not. They would have to actually be seen. An event would be when we actually billed for the service. So somebody could call Genesis from Tilton and say, I would like to come in for an intake. We would set you up with that appointment. Typically, intakes run, you have to provide an intake within 10 days.
So you billed 135 residents?
Yes, 135 people were seen for billable services.
Okay, all right. And some of those were charity cases?
Yes, the billable services doesn't mean we got paid for them.
Right.
I know. But of that 135, that's where you said that you've had, the charity increase was 148%.
Over 2
Over the
years.
past 2 years, okay. How many of those 135 were charity cases?
Let's see if it tells me here. It doesn't tell me on this
I think it tells you in your letter.
Yeah.
that you had.
The 33?
No, they saw emergency services. I don't see it.
21 clients received emergency, oh, right, you're saying how many received charity, you're right.
Yeah. I don't know how many clients receive charity care. I could try to find that out for you. I know we provided all I get in this printout is the dollar.
I mean, to me,
number, but
that's
I can find out.
important in
Yeah.
terms of us giving support, because those were the people that you would really have to be, otherwise you're getting a reimbursement from insurance. You said that you've done training for the police department in the Tilton area. Do you know what the nature of that training has been?
I don't. We met with Chief Cormier last year to talk about needs for his department and what they would like in terms of training, made the offer to help if they needed anything. I'm not sure if anything's been provided in the past year. We can find that out for you as well.
Okay.
But we're certainly there to offer it if
One of the
I do
things,
think we have an answer to your question. I think, Kristen, it's 21.
no, that's just emergencies,
That's
it's not
emergency
charity.
services.
We want to know how many
Oh,
people
it's not,
received
gotcha.
charity. I know, I did the same thing. One of the things that we have staff who've been trained in is something you may have heard of, it's gotten a lot of press recently, is mental health first aid, which can be helpful not just to police, but also to the general community, and is something that Genesis has a couple of staff folks, I think, who are
Three.
trained. Three, well, more than some places. Three individuals who are trained to provide mental health first aid, which is really sort of to help people in from a variety of backgrounds. What do you do if you see someone having a psychiatric crisis? So.
Okay, let's see. You talked about, in the past, you've had people at the schools helping out with student problems and so on and so forth, and that now you don't. What are the plans to do that? And the reason I ask that is that today, Wayne and I happened to be over at Union Sanborn School, and they have some serious issues with children in need of services, and some of those fall under the auspices of mental health issues. And there was someone from Riverbend there. They work very closely with Riverbend, and we did see someone from Riverbend there today working with one of the children there.
Okay.
So I'm curious as to why, since Riverbend is not,
It may have something to do with what town the child is a resident of, because Riverbend
Okay.
would cover Northfield residents.
okay,
And Genesis would cover Tilton and
Correct.
Samberton residents.
correct.
So that that would be the only reason I would see
That's
Riverbend
me
in
too.
the Winnisquam School District.
Okay.
We are working to get somebody back in the school.
Okay.
I know, I talked to our children's director this morning, actually, and she said she is working on it very hard. So it's just a matter of finding a clinician who is able to provide that service.
And it's the right fit, obviously.
Right. And like I said, in the meantime, until we have someone in there, one of our children's coordinators meets with school staff monthly, and so that they can, feel comfortable, hopefully, reaching out to us.
Okay. All right. That's all I have. Thank you.
Can you tell us more about the senior, what you do for the seniors in the town of Tilton? You mentioned the REAP program.
Yes.
What is the REAP program?
So REAP stands for referral, we have all these acronyms. Referral, education, oh gosh, what's the A? stand for?
Assessment.
Assessment program. So that, it's a program that, it's through a grant, and the grant's actually held by Seacoast Mental Health Center, which is the Portsmouth-based center, and then they disperse the funds to the other agencies. So through REAP, we're able to provide outreach services, so we can go and do presentations for seniors on, mental health issues, things to watch for, provide them with, educational activities and things like that. I know that when Sarah was at the senior center, our REAP counselor had done several trainings and several outreach events. I know there's been some turnover, and I'm not sure what's
I think you
happened
did
since then.
one when we opened.
Okay.
3 years ago.
Yeah.
I don't think you've done one since.
There was
I know
been
she's been-
one done within the last year.
Okay.
What do you, what is done for the seniors in the town of Tilton? Do you actually go to them, or are they required to go to you in Laconia?
It depends on the service that they're receiving. So if So they may need to come into our office. If their treatment plan calls for community-based services, then we would come to them. We do offer assistance with transportation through our grant-funded van that we have. So we're able to facilitate that somewhat for people.
How many times have you ever used that in Tilton?
Have we used it in Tilton?
Yeah.
We bring people to Tilton, I believe, at least once a week for shopping, errand, groceries, things like that.
From your place
Yeah.
down to
Yes.
Tilton? But how many times have you utilized that for clients, patients in Tilton up to your place for treatment?
I don't believe we use it in that way right now. Do you feel that there's a need for that? I could certainly bring that. We're actually looking at applying for a second.
Well, we're
van.
always bringing the seniors up to you,
Okay.
so I'm wondering why the
Yeah.
seniors that are in that kind of care that need to go all the way to Laconia need to find a ride to get there to Laconia. Buses don't go at the same time that your appointments are.
Right.
So it's the senior committee that usually takes them up.
That's good to know. Like I said, we are looking to potentially apply for a second van. I'm actually going to the bidders conference for it on Monday. So that's good to know, and I would love to talk to you about that more if we do that. I think part of the reason that we're not able to provide that kind of demand response transportation is because we do serve 24 towns, and I think that would just be really unwieldy for us. I mean, as much as we would love to do that and help get people to appointments, it's a 10-passenger van, and it's, it would be really difficult to have it go to all 24 towns that we serve to bring people to their appointments. But if we do look at a second one, that's good feedback.
I'm just thinking, if you have 3 or 4 in the same complex that are all going to the same place, some the same day.
Yep.
One day last year, we had 3 people driving, and it was within the same hour.
Well, maybe you could help with some of that, because one of the constraints that the mental health center has is under the HIPAA and privacy laws, so that we can't actually say, Kim, you live in the same complex as Pat, and you both have appointments coming up, so we could try and schedule them together and put you on the
If the
bus.
clients go in and say, I can't get here, what do you do?
So, well, sometimes we do have staff who can provide transportation, but my
That
point
was
is,
my
I think...
question to you. What happens if 3 of them go in there and say, I can't get there to you? What happens?
Well-
I need help, I need mental health, and,
We do work with folks.
I'm 85 years old, and I just can't get there.
Well, we do work with folks, we provide services in the community, we work with folks to get them transportation. But I think you raise a great question, place where we could perhaps collaborate with you to try and use as I said, we can't really, makes much more sense, as you say, if you know of 3 people who need to get to Genesis on a weekly basis, if we could find a way to get them traveling together, that would be great, but we can't really... We would violate federal law by trying to negotiate that, but maybe you could
I'm
help
just
us
trying
negotiate
to
it.
see how you provide, seniors some type of, how you outreach to them rather than making them go up there at 85 and 89.
And the REAP counselor is able to go to people's homes and work with them, but she's not a therapist. So if somebody needed therapy, outpatient therapy, she can't do that, but she can go to their home and she can provide them with support, and she can link them to other resources, and she can do all of that. It's sort of like, she's like the case manager, but she can't go to their home and provide therapy because that's not a therapist position, unfortunately, but she can do outreach and help facilitate services for people.
And I know you have psychiatrists, but I don't think they do house calls.
No.
Psychiatrists tend not to.
They are booked solid all day.
Silly.
Sometimes I don't even think they have time to go to the bathroom, so.
Patty, you all
Do
set?
you have psychiatrists? 'Cause
Yes.
that's what you're asking earlier, is there's no PhDs. What's the difference?
That would be a psychologist. but,
The psychiatrist has an MD.
Psychiatrist is not.
So you have MDs.
We have
Right.
MDs, but no PhDs right now, that I'm aware of.
Psychiatrists, you get to add more letters to the end of your name. You get your PhD in psychology, then your MD, then you become a psychiatrist, then you become board certified, in specialty areas.
You're a medical doctor if you're a psychiatrist.
Right, and that's why it was confusing, because it was like, how do you do this without
No,
them?
no, yes, I
What are you talking
understand.
about? What happens with somebody who's really,
Yep.
you have more than that.
Right.
More, okay.
How many
All right.
psychiatrists do you have?
Let's just write that whole section of
I'm
questions
not a
out.
psychiatrist.
Okay.
We have 3 psychiatrists, so 3 MDs, and then 2 APRMs.
Yes.
Are
Ms.
the
Martinez.
That's just adults,
MDs,
though, you're talking, or
No,
you?
that's children too.
are the MDs
Oh, 4 MDs.
Okay.
employed by Genesis?
Yes.
Correct.
Okay, full-time, they're not,
Correct.
okay,
No,
just come to the hospital when you need somebody, okay.
Right.
No.
They're employed by
Alright.
Genesis.
No.
Nurse
So, yeah.
practitioners are actually qualified to practice under the license
Yeah.
of the
The
doctor.
doctor.
Right.
Stan, go ahead.
My questions, are you considered a nonprofit?
Yes.
Yeah. And then you're a required provider with unfunded mandates. How do you become the required provider, and how long have you been the required provider at Tilton?
Genesis has been around since 1966, so we have been the mental health center since that time. What we have to do is we have to apply for it. Be designated by the state to provide the service, so every 5 years, we go through a pretty rigorous redesignation process where the state comes in and, they look at us more than every 5 years, but every 5 years is when we're redesignated. They come in and look at our records, do audits, interview our board, interview our staff, interview our patients, and that's how we're designated as the mental health center. So we just went through that last year, so we've been redesignated for 5.
How do you determine the requested amount?
We use a formula, which was actually suggested to us by the Tilton Budget Committee, because this was before I came to Genesis. I've been there about 5 years, but prior to that, we went to the Budget Committee and asked, and they said, well, how do you figure it out? And at that time, they said, well, we just kind of, come up with a number. And the Budget Committee said, well, that's really not fair. Why don't you think of something a little more equitable? So they went back and we came up with a formula. And how we do it now is we look at what we would like to reduce our emergency services deficit by. So as we said earlier, it's an unfunded program. You can imagine having a master's level and a psychiatrist on call 24/7 is quite expensive, but it's like the fire department. They're on call whether there's a fire or not. So we look at what we want to reduce the deficit by, and then we take the population of your town, and that's how we come up with the request.
Sounds like something you suggested.
Was it your suggestion?
Probably.
It was your suggestion. Thank you. It made things a lot easier, I think, so.
I got a question.
5 years ago, yeah.
How do you make, you're gonna have to give me a subjective answer, but I'm sorry, I don't know how else to, but you say that the emergency services alleviates the burden on our town and its resources, and you go on to say that you help out the fire, the police, the first responders, and welfare department. How do you think you do that? And that's why I said it's going to be subjective. I don't know how, but I'm
So,
curious.
My opinion on how I think we do that is, if Genesis wasn't able to come in and provide emergency services, those people would be calling your police department. Those people would be showing up in the ER with no one who's really qualified to help them. They would be sitting there. Then your loved one comes in having a heart attack. There's a person with a psychiatric emergency sitting there taking up the bed, taking up resources from the hospital. We are getting people well so that they are productive members of this community. They're working, they're volunteering, they're, doing the right thing, and then they're not coming to your welfare department to ask for money because they're able to participate in their communities. That's my opinion. I don't know.
The other thing that you would see, and we
Folks have
have seen, certainly, I think everyone sees the media about the criminalization, as they call it, of people with mental illness, but you would definitely see an increase in arrests, in, particularly criminal mischief kinds of things. I think, frequently, local PD are able to, particularly they know that in our small town, they know folks, and they see, oh, Susan, you better get down to the ER. because, obviously you have not been taking your meds. So, I think the reality is you would definitely see more arrests and, more resulting in prosecutions and probably eventually stays in the county.
And I will
House
add to
detention.
that, because you would have an increase in time spent on site. The fire department, if there was a suicide attempt, they would have to be on site until it was resolved, and that could be hours and days. Police departments could end up in a hostage situation. But it's actually an interesting hostage situation, because the suicide person takes themselves hostage and plays it out for a certain amount of time. The other expense is the prayer and complaint, that when a prayer and complaint is sworn out, local PD has to sit with them until the psychiatrist okays them either for admission or for send them back home. So there is some time and money involved in that kind of situation. And then the follow-up services in regards to any of the emergency services could be expensive. Further question?
Let's say I have a psychotic break, I'm not taking my meds, and I've just moved into Tilton, and I end up causing a scene on Main Street. Genesis isn't going to, this is why I'm asking, Genesis is not going to be called. The fire or the police department are going to be called.
Until they go to the hospital.
And they have a choice of either taking me to Concord or taking me to Franklin. It doesn't necessarily get Genesis involved. That's my point in asking the question.
To Concord Hospital?
Which is what has been done very frequently in the town of Tilton because of the lack of response they've gotten. So that's the only reason I'm bringing it
Why
up,
would they not take them to Franklin?
because they haven't been able to get the services they need there.
But even in Concord Hospital, then Riverbend would have to provide the service, and it would depend on whether they have services available. Also, that would mean that the two police officers would be sitting in Concord Hospital until there was a resolution to the problem.
And
that's what's happened in the past, but that's why I'm asking Genesis.
one of the benefits that we do have in this local community is that just a little over a year ago, the designated receiving facility at Franklin opened. As you probably have also seen in the media, people spend, and particularly Concord Hospital's been out, it played up in the media a lot, people spending days, sometimes weeks in the ER, awaiting an inpatient psychiatric bed. So it is a benefit that we have here, that if someone it would be able to be served through the DRF here in Franklin, that they could. There are some folks who maybe are if they're particularly violent and such, that it's a small little unit, so it would not necessarily be appropriate, and they might still have to wait for a bed at New Hampshire Hospital. But we do try and refer people in there.
Okay, just a second, I want Stan to actually have a chance to finish up.
Yeah, I always have a list.
Sorry.
You keep moving.
All right, my question was, how did you determine the requested amount? And that was by population of the 24 different towns. Which other towns granted your request?
So last year,
Percent numbers or?
19 out of the 24 last year. So we continue to ask every town, every year.
And then you're asking for this money from the towns to fill the deficit in your
To help support the deficit, correct.
working versus, just quick numbers on the calculator, rounded off, just for everybody's, correct me if I'm wrong, but with 133 different people, or 135, I forget what the number was, it went back and forth, comes to $75 per person, roughly. 2,000 events for these 133 people comes to $5 per event. And then earlier you were talking, and you weren't sure with Jane on her charity numbers, and you came up with a number earlier of around something $4,000 of charity.
20,000.
20,000.
Was
20,000.
was how much charity care we provided to
Not
this year.
covered by
How much
insurance.
was it?
$20,411. That was for last fiscal year, so fiscal year 14.
That's all I have for
Eric,
questions.
can we go to Catherine for a second?
Absolutely.
I was just going to make a comment on why Concord, not Franklin. Because there has been an increase in mental health issues, drug-related, whatever. The larger hospitals have been training their staffs to deal with mental health patients because the response from community health, mental health people, sometimes people are sitting in emergency rooms for 24 hours, 36 hours, or days, waiting for somebody to come and assess them and say, yes, they can go home, or no, they need to go to one of the facilities. There aren't that many. So that's why we would send people from here with mental health issues to Concord and not Franklin or Laconia.
May I just respond to that?
That's not my opinion, that comes from the governor's
Right.
report that came out in January of last year.
I think
it's online, so you probably ought to read it.
Yeah, I have read it. I just wanted to say that, that the people sitting in the emergency rooms aren't necessarily the fault of the community mental health center. We go right away, but if there's not a bed for them to go to, they have to sit there. We can't, our hands are tied.
That's not the report talks to. The report specifically talks to people arriving in an emergency room with a mental health issue, and nobody responds to assess them as to, as I said, whether they can go home or, back out into the community or to a bed. So it's not people waiting for beds, and that's directly from
Actually,
the report that I've been
I have read that report, and as I said, I've been doing this work for quite some time. The reality is that they can't hold you at the emergency room if you haven't had an assessment. So unless you're being placed under arrest, in which case, if you could be removed to a jail. So if without the assessment, you can't be held there against your will. I suppose.
I'm sure they're not being held against their will.
Well, most people
begging for assistance, begging for help. But that's directly from
anyone who's waiting for a bed at New Hampshire Hospital is being held there involuntarily. They're going through an involuntary emergency admission process. We do have, as I said, in Franklin, you can go in there voluntarily, which is nice if you can. But you can't, your family members often feel better if they can choose to go in voluntarily. But New Hampshire Hospital, there are no voluntary admissions.
Did the governor's report have any suggestions on upping the funding for community? Because,
No.
just explain to me some of the unfunded mandates you discussed earlier. Give me, some sort of examples. Or something that we can give as an example of, you put you guys under a stress of you have to. Now you have to do it here. You're required to do it in these 24 towns. It's not enough. And we're complaining that they're going to Concord because they don't have enough.
Well,
an example.
to be fair, the mental health center in Concord is not sitting there saying, oh, we have plenty to share. They're making, they're in the same place. Every mental health center in the state faces the same unfunded mandate around emergency services or underfunded mandate around emergency services. And everyone looks to, now, the mental health center in Concord, has a relationship, we have a very good relationship with LRG Healthcare and Spear, but they have a relationship where they actually share. I believe the CEO of Riverbend is also vice president of behavioral health services for the hospital or something, so they have a closer relationship, but that is, they're different from the other parts of the state.
I think what we also find is that people who say that they have insurance and then don't, and/or people who are in the process of trying to get towards Medicaid and aren't quite there yet to get those services, it becomes, we provide those services, then we bill them, and there is, we probably lose $200,000 to $300,000 in unbillable receivables back that people have not been able to provide back from the 24
Also with
towns.
emergency services, if someone shows up at the hospital, is in crisis, needs to be assessed. In this area, it goes to Franklin Hospital, they call Genesis, they must provide that assessment, whether the person can pay for it or not, at that point in time. So that's an unfunded, the mandate that they're required to do it. Question for Catherine, the governor's report, I got you in a second. The governor's report, was that for all mental health centers or just for Genesis?
It was information gathered from 15 different hospitals.
Well, again, but is it for...
It's for all community-based.
Okay, so it would not be fair to say that Genesis was doing that. It would not be fair to say Genesis...
Nobody did.
Well, I was getting the implication that this was a Genesis thing and not statewide. If it's statewide, then Genesis, Manchester Mental Health, Concord are in the same boat, that people are sitting in the visiting room, in emergency rooms for that length of time.
This is data collected from 15 hospitals throughout the state. So they're saying statewide, this is a problem. Here's a statistic. Nearly 1 out of 3 people waited more than 24 hours in a hospital emergency room for mental health treatment. The average waiting time was 2.5 days among this group of patients.
But is that specific?
That's not an assessment.
That's not an assessment, that's admission to a hospital for treatment.
Right.
Well, if
That's
you read this
different.
further, that's not so. You need to, you need to read the report.
And
And I
that
have.
report was actually written in response to the dreadful situation at the Elliott Hospital.
Right.
There were some folks who'd been held for long periods of time, and finally, there were staff who were seriously injured, and then one patient who wound up a quadriplegic after an altercation with hospital security. So the governor, at that point, asked for this report, this investigation into the wait times. So specifically, it was around these extensive wait times that people were having at emergency rooms across the state for an inpatient psychiatric bed. It's usually what they were waiting for.
There is other reports also that one should look at other care. Cardiac patients are experiencing the same waits for beds. Nobody goes to ICU until there's a bed, so you actually wait in the emergency room until that's done. But I want to go to Pat first, because she was first, and then John. Pat?
Let's go to a different subject and money. I hear deficit and deficit and deficit, and that's what I've heard tonight. And yet, I see in the report here that we have $1 million in the coffers. And I know that we've gone over this in past years with Genesis. You're a nonprofit organization, and you're asking the towns to contribute, but yet you have $1 million in investments.
4 million.
So can you, over $1 million, so can you please explain why
4 million, 120.
we should, the town, the taxpayers, should continue to pay when, I mean, you just heard Pines Community, they don't have any money in the bank. And they're just making ends meet. And they're asking for everything that they can get to just keep the doors open. Here you have $1 million in the bank, and
We buy state...
$4 million in the bank.
No, 1 million, it's 1 million, it's 1 million.
Well, your
It's-
total assets are 4 million.
The assets are $4 million, but $1
Sure,
million in the
because we
bank.
own property and have to maintain that. So a couple of things. One is that is sort of our reserve fund for a crisis, an incident, a property, a facility that we do own and maintain. Something goes wrong, that is sort of our reserve fund where we would go to, just like you would have reserve funds for your buildings or facilities. Secondly, the state does require us to have mandated ratios around our requirements, and without this investment account, we would not be in compliance with state mandates on a variety of the ratios. So every month, we have to provide a series of ratios to the state on our financial indicators. We have had many months where, had it not been for the investment account, we would not have been in compliance with the stated mandates to do that. Third, the market has been great, and so while we're at a place of 1.2 million on the report, we actually have, with the last 3 days of the market, gone down significantly. So it is an investment account that we rely on that fluctuates as the market does. And I would say the last thing is that we are looking at our facility space and have been trying to save a bit more money related to the facilities that we need. If you were to see some of our current spaces, you can see some of the deferred maintenance challenges that we have, and we will use a good portion of this money to update a facility so that we're better serving the patients of our area.
Thank you. John?
Yeah, so the financial reports we have, they were for your fiscal year ended in June.
Which, I'm sorry, Kristen, what were they?
Yes, for fiscal
Yeah.
year 14.
Okay.
Okay, and a lot of the expenses that you divided up amongst, according to population, was for things that were not covered by insurance. As last year was the first year that the affordable health care went into effect. So that means that everybody should have insurance, plus they increased the eligibility for Medicaid. provided everybody did apply for it and do that. Wouldn't this lower the amount that you actually need because more people now are mandatory to have the insurance, so there will be less demand on the towns to chip in for the people who don't anymore?
You would think so. The data that we have at the moment is not finding that the people who are required to are they'd rather take if they get caught, they're going to take the penalty rather than pay. So to date, we have not seen the transition over to the mandated health
Is there
care.
any change at all?
We haven't seen any
We haven't seen really
to
anything.
date.
Expanded Medicaid, or the New Hampshire Health Protection Program, whatever we're calling it, only went into effect on August 15th, so we haven't seen really any effect from that at all yet. The way we are working with our patients to help them access that service is when somebody calls for an intake, our intake person asks them a series of questions about their income size and their family size and looks at her chart and says to them, oh, it looks like you may qualify for this program. Would you like to speak with one of our benefits specialists who can help you? Sets that up for them. We can help them with that process as much as possible. We can help them fill out the application. We will put a stamp on it for them. We will make copies. But we're also finding that some people don't want that. So, we're offering that help, but we can't force it. So people will say, oh, I'll take the application home with me. We never see them again. We never see the application again. And these tend to be our patients who they obviously don't have Medicaid, so they may be a little more higher functioning. So we're not really seeing them again with that. But that's where we're at right now. Maybe in a year's time, we'll have a different
Possibly
trend.
next year, maybe less if
Right.
especially if you're doing the effort to get the people, because a lot of people that might have some disabilities or that, they're going to go into crisis more often. Actually, just trying to figure out the health insurance might send them to you.
Yes.
I had to help my adult child, and I was like...
So, like this
Service
number
link's
next
great,
year
though.
could very
She was in
possibly
Tennessee, so I was trying to figure
be, it won't be zero, but
Right.
it could be maybe 15% less or something.
Exactly, and that's what
We
we
are
hope.
hopeful.
That's what we
Yeah,
hope to
that
do.
is
We know you
exactly.
have a really tough job, and we understand that, and I go to a lot of these budget hearings, and I know it, and we really appreciate everything that people are able to do. We just want to make sure you understand our services and how they, help your town.
And to our most patient member of the evening, Eric.
You kind of mentioned something, and kind of Pat mentioned something, hit on something earlier about, I don't know if the correct word was that you were using, Pat, but I guess in your example, you were using someone that seemed to get bounced around from,
You're doing good. Go ahead.
bounced around from like doctor to doctor, so to speak. And in your case, counselor to counselor, thank you. That was the word I was looking for.
Continuity
But
of care.
in your case, it seems like your person has been consistent in their care. What would you say the percentage of your people are in your example versus her example?
I would, and totally, first of all, I want to say, my loved one has certainly through the years, as I said, they've been a patient at Genesis for about 15 years. They have seen a lot of bouncing around, and there have been times when I have been not happy about that. That said, as I mentioned, I also work for another mental health center, so I also know it's sort of it is sometimes the reality of how transitions happen in mental health centers. So I think that it takes a while often, and especially when you have folks with severe mental illness too, to get that, because it's not even just about Genesis saying, okay, we're going to have clinician Susan work with John. Well, if John decides, true story, I believe clinician Susan started the Iraq War. And so I'm not willing to, work, I'm not going to show up for appointments, I'm going to dodge her downtown, all real stuff, then, okay, now we have to work on another answer. So, and then at the same time, they move to clinician Jane, and then clinician Jane says, oh, I just got my master's, right? yet, so, now I'm going to go do something else. So it's a very difficult situation. Genesis has had a difficult time with staffing because we have not been able to provide increases for, as Jim said, over 5 years. We lose folks to Riverbend all the time. It's very competitive. We lose some good folks there. We have some very dedicated folks who have stayed with us. So it's difficult to give you percentages, but I'm not going to sugarcoat it. The reality is that a lot of folks, particularly, you're going to see a lot of transition at times, and then you'll have periods of time where it's going to be far more stable. And always the clinical goal would be to provide you with that continuity of care wherever possible.
Thank you. You say 135 residents were served. Does that include the kids in the school that are met with there? Now, does that includes, like, let's say you meet the student, and all of a sudden you discover they're a Northfield resident. Is that included in that, or is that just strictly?
That would be Tilton residents.
Okay. Or if they were a Sanborn resident or anything like that, they would?
They would be included in Sanborn.
Okay.
Yeah. We served 3,642 people last year. So the bulk of that's obviously Laconia.
Yep.
But I have a count by town.
We went through that today over at the Union Sanborn because it drives the principal crazy. Because not only does she have to ask, where do you live? Who are you seeing? And then it's either Riverbend or Genesis. And at this point, she was saying, don't move. Because if you move, we have to go through all this again.
What is your average request per town? Of the 19 towns that support you, what is the average request?
24 towns. Oh, yeah, 19, agreed.
It's anywhere between,
I guess what would be your highest request?
our highest request is Laconia, which is $47,000.
Yeah.
They're the biggest population. Most towns are around what we're requesting of Tilton, anywhere between $5,000 to $10,000.
And what are the towns that don't support you?
The towns that don't support us, Bridgewater, Campton, Tilton last year, Barnstead. Nope, Alexandria does. Sanborn, thank you.
Sanborn had to be in there someplace.
Yep.
Earl Layton's been loose. Okay, that'll get me in trouble, won't it? Earl and I go back. Yes, sir, go ahead.
No, you guys asked all the questions. I kind of was...
Wow, I've still got my voice. Are there further questions, discussion from the Budget Committee? Tom?
We're catching up on a couple of years' worth of questions here, aren't we? Glad you came in.
You're very well prepared, by the way.
One of the things, also is the, not the Band-Aid and helping the people when they go into the crisis and being there, but the outreach part, the educational things, maybe, like doing some teaching at the police station, or maybe going to the senior center and helping, have somebody do a little talk on how to recognize loved ones and what you can do for them if they're like this and that. And I think that's one of the things that makes a lot to the community when we go and tell the taxpayers, well, you're going to pay this or else. You have no choice. We're going to pay it. What are we getting for service? We don't have anybody that uses our services. Why should we get it? And that's what kind of things could be done that way.
As far as outreach?
Outreach.
Well, like I said, we're happy to provide trainings for the police. We're happy to provide training for the senior center. I think what's important about emergency services and what we're asking for the funding from the towns for is for people to know that, we hope you never have to use it, but if you do, it's there. And, we are able, if God forbid, your town experienced some sort of crisis that affected, a lot of people, like just as an example, there was, several years ago, there was a suicide at the Guilford High School. So obviously that was a traumatic event on that school and on that community and on a number of people. So we are able to bring counselors to the school, set up, do some post crisis counseling, and that's part of emergency services. That's part of what we do. So we're able to go in and work with the community after a crisis if you need it. We hope you don't need it, but it's always there if you do. And I think that's the important thing for people to understand, that, you might not ever need it, but the reality is you're probably going to know somebody who will. With 1 in 4 people, 1 in 4 adults and 1 in 10 children experiencing a mental health crisis in a year, it's likely that all of us are going to know somebody who's going to need it, and that's what Genesis is there for.
Yeah, and I'm not sure if it came across it, but what I'm looking for more is, like a lot of the other nonprofit agencies that we fund, whether it be the Red Cross, who teaches some, first aid, fee, or babysitting classes, or there's a couple other, I think New Beginnings goes out and talks to some of the schools and has little, some lectures and tells that. And just about every other organization does something like that, except Genesis is just sort of waiting just in case, like a Band-Aid. So you don't get the recognition other than you're a safety net. So nobody really sees it, and I think a little bit of community outreach and the investment in that would make a lot to be more accepted in the community and not just...
I think one thing that going forward this year that we, Susan talked about the mental health first aid, and we do have 3 staff who are trained to provide that now. So that's something that, perhaps we could collaborate on in the next year. I know they're working on putting a training together, like their trial run training, and then hopefully they'll be able to bring it out to the greater community. So we'll put that on my list.
I think
About that for sure.
something like even public service announcements.
We do have public service announcements.
But are they reaching the local area? I guess I'm asking that, and I'll give you an example. Pat and I are very involved in the senior, okay? And I recently got a call from someone in the town of Tilton who had gotten a call from someone in the town of Samberton, and all of these, the thread that ran through everything was the Tilton Senior Center. And after going through a lot of different steps, I finally got some help for this particular family. And I guess what I would like to see is that in a situation like that, that family already knowing that they can call Genesis, and that's what I don't think we're seeing. Is that the kind of thing you're saying? Because we do, I mean, this year alone, I've been touched by 3 suicides. And,
So sorry.
It's not my immediate family, but people I have known and cared about really well. And, it does exist in our community. Mental health issues do exist. And I don't think that the people in our community know that they can pick up the phone and they can call someone in Genesis, or that people feel comfortable saying, have you called Genesis? And I think that's why we have been reluctant to give you money, because that is not the feeling in our community. And I think it needs to be, and I don't know how we can help you. I think that's something you need to do through public announcements or through more visibility in the community.
I think each of us have had experiences where we have experienced Genesis falling short of their commitment to us in the past couple of years. And I think that's significant enough to us, because it is mental health, and it's something that we can't allow to fall through the cracks, particularly with people that can't help themselves, that aren't in a family situation such as you are, with support. And I think it's devastating to see. It's more devastating not be able to help. And unfortunately, there's a lot of people sitting at the table that have experienced less than the commitment.
And I would encourage anyone to always contact the Mental Health Center. Unfortunately, our Executive Director, Maggie Pritchard, wasn't able to be here with us this evening, because the reality is, it's very important, as you say, for people not to fall through the cracks, and so we need to know when that happens. And also because there isn't any, it's not like there isn't someone else, so we need to work with our communities so that we can try and provide those services. It's I mean, even if you wanted to go to Riverbend, if you live in Tilton, they're not going to serve you.
Right.
But we definitely want to be always looking to improve, and we always want to hear that feedback, Pat. And I would encourage you to contact Maggie directly.
Well, I think we're in the same quandary as you are, because we're volunteers that get out there and help where your other people are not just Genesis, but other people are not. And that there's services in Tilton, particularly for seniors, that we now have a committee that picks up some of the slack so that they don't fall through. And but I can't just call up Genesis and say, oh yeah, Mrs. Smith really needs some help. I dropped her off and she came out of there and just frustrated as heck. I mean, I could go on and on with stories, but I won't. And I can't do that. Number one, I can't do that because I can't do that to Mrs. Smith. She hasn't given me permission. And number two, I can't do that because it's not going to get anywhere in Genesis, because I'm just a volunteer. I'm not a professional that's calling you up to say this is what's happening. It's not. It's going to fall on deaf ears because as your HIPAA requirements, I can't tell you that.
Well, we can listen. I'm not a clinician. We can listen. We can't tell you. So anyone can call. And I always encourage family members, because sometimes, you to always remember you can call, and I say this across the state, you can call a mental health provider and say, you don't have to tell me anything, but I need to tell you what's going on. So that's always open. And the reality is that, if someone called Maggie Pritchard, our executive director, to tell her, and you may not, also because you don't want to violate your confidential relationship with Mrs. Smith, but you can certainly say, here's something that I know is going on. I can't tell you who it happened with, but I think it's an issue, and how is this best addressed? And then you can try and work, even though you can't give information, with, okay, where do we need to go to try and fill this in? So, but, we just try and still respect the confidentiality of Mrs. Smith's in the world.
Very good. Catherine, I'll get back. Catherine, that takes care of the Board of Selectmen. We have them. Everyone, you don't get a second bite. You already got your one bite, okay?
It would also be tough for them to, quote-unquote, advertise or, outreach or, have staff go when you're already crunched, you're already, I think also you're getting more, the increased number of people is by awareness, people being aware of mental illness. There was a football player, they do the pink pants, well, the guy wore the green ones. And he knew he was getting fined, and he voluntarily fined because he has mental illness. And everybody was amazed by that. And then after I heard that, talking to another friend, it's not a stigma anymore to say, my wife has mental illness. And then I told him, watch the ESPN thing on Brandon Marshall. You'd be amazed. That's exactly his same things that he was talking about. He's like, really? And it's just, and it's going to get worse. The number one casualty of the Afghan and Iraq wars are suicides.
Yes.
It's not getting better. But it is getting better that there is awareness of it.
With that process, you have put up with us for a period of time at this point in time.
What do you charge by the hour? Because, we're in for $100 already.
Thank you so much.
We always leave with you folks having the last word. So if you have anything you'd like to leave with us, please feel free to speak.
Thank you for your suggestions. As far as outreach and advertising, we do some advertising, and I don't know, I'm hopeful that it reaches a lot of people. We do advertise on 2 different radio stations that would reach your residents, so hopefully people are hearing it on that. Another thing that we have started in the past, this year will be our 4th year doing it, is we put out, for May is Mental Health Month, we put out an educational insert in 5 of the Salmon Press papers, and the Winnisquam Echo is one of them. And it's really really for us, it's somewhat of a fundraiser, but it's more of an awareness raising piece. So it's an insert that goes in every paper, and it has articles about mental health and information about mental health. So look for that in May. It'll be out again in May. We've done it the past 3 years. But I'm always looking for new ways to, I came to Genesis 5 years ago, and I can't tell you how many people said, who? What do you do? So I think over the past few years, we've really been chipping away at it, and maybe we haven't gotten quite as far as we needed to for Tilton, but we're working on it for sure, and I appreciate your suggestions.
Well, I think there's still a stigma about mental illness, too. I mean, when I look back, and I'm old enough to be able to say this, I know when epilepsy was a stigma associated with epilepsy. That's gone away. There was a stigma associated with brain injury. That's gone away. There was a stigma associated with Alzheimer's. That's gone away. But the stigma of mental illness still has not, and yet probably the biggest chunk of the population is touched or has been touched by mental illness. So I think it's something that we all have to do as a team, too.
Yep.
So we appreciate your coming in and what you do, okay?
Thank you.
And to keep my promise, anything to say from back there?
Thank you for your time and your questions, I've learned a lot. And,
Thank you.
And the feedback.
Yes.
Thank you. We are always welcome.
Thank you. Appreciate it very much.
Yes.
I'm
Good
going
luck.
to leave you with some, not that you've probably had enough of us, but I'm going to leave you with some of our annual reports, which weren't ready when I sent in the application.
Excellent.
Thank you.
There you go. If you're interested.
Good. Have a safe trip home and keep warm.
Thank you, you too. Thanks so
you all
much.
very much.
Appreciate it. It was nice meeting you all.
Like brochures or something along those lines. I know downstairs we have brochures in the front for Winnisquam Transit and
I'll get
things of
some
that
to you.
nature, right?
Absolutely.
Yeah, I'm volunteering the town to do that. It's not my place to volunteer that.
We'll
But I
just
would
take that
imagine
budget
if
away.
Come to the senior center again now
Winnisquam,
that we
Winnie
have
Transit
somebody.
has brochures downstairs.
She's written a book on all
You can talk to the selectmen and clerk and,
Great idea.
Thank
Thank you so much.
you.
Yeah, I'll make sure to get you some brochures.
Thank you very much. Okay.
I got one. I'm all set.
Well, let's do a couple of administrative things, and then we'll get out of here, because people have had enough, I think, for the evening.
What do you mean?
Yeah. One request, Tim, there were 2 emails from Tim Pearson. One about if we can get the agenda to him a little more quickly to put up on the website. Second thing is if the committee would allow him to be a member to receive any kind of notices that we have. Okay? So that if they need to be posted on the website, they could be done so. Okay?
My
John?
thoughts were, the budget committee, group emailing should be the budget committee, but also CC.
CC to him, I have no problem with that.
And CC Tim on things.
Joanne, is that possible? Okay, good.
And selectmen, some of them get...
And CC the Board of Selectmen, but keep the...
Now, my recommendation for the next meeting is that we take up the selectmen's budget, Pine's budget, and Genesis budget. But for discussion, for the next meeting, this will give you the week to take a look at it. I would also suggest that we table the meeting minutes for tonight until next week, take them up at next meeting. If the committee is so wish to do that, I don't have a problem with that. And if the committee is wishing to do that, the chair will entertain a motion for adjournment. Yes, you may.
Last week, you asked Jane to get some information. I think you appointed Jane as the person to get information from the welfare director.
Yes. Do you wish to report on that today or next week?
If you do, I suggest that be in a non-public.
I was going to say that I think that we should hold that. That's going to be rather lengthy, and we do need to do it under 91A:3.
I will certainly entertain that motion next week as we're sitting as a committee. Are there any further business before the committee? If not, the chair will certainly entertain
I make
a motion to adjourn.
To adjourn.
Do we have a second?
Stan.
All those in favor say aye,
Aye.
and please